AAPC CPC Model Paper 1, Chapter 11. This includes CPD code series of 50,000. There are 6 questions will be tested. This will test your knowledge on surgical procedures performed on urinary system, the male reproductive system, the female reproductive system, including maternity and delivery, and the endocrine system. So let's see the questions. Question number 1. The patient presents to the gynecologist office complaining of stress incontinence. The gynecologist decided to perform a sling operation using synthetic materials to reinforce the patient's muscle and allow for additional urinary control. This procedure is performed laparoscopically in order to be less invasive. What is the correct code for this procedure? So you can see there are 57,000 and 51,000 codes are there. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Here you have to highlight this is stress incontinence, sling operation using synthetic material done through laparoscopically. So when you see the answer, 57,000 adjacent codes are there and 51,000 adjacent codes are there. So you can use the elimination method to find the answer. So directly go to the code and see. So when you go to the code 57,285, that is removal or revision of sling for stress incontinence. But here we are inserting. So for 57,288, that is sling operation for stress incontinence, fascia or synthetic. So that is the case here. So stress incontinence, sling operation using synthetic material. But keep in mind, this code does not say anything about the laparoscopic method. So this seems to be an open method. When you see the additional note here, you can see within bracket it says for laparoscopic approach, use 51,992. So very careful when you see the first answer, don't rush to put the code as B because this is open procedure. If you this procedure done laparoscopically, so the additional note says for laparoscopic approach use 51,992. So this code is continuation of the 51,990, that is laparoscopy surgical. You can see semicolon. So after the semicolon, you have to read this one. For the next code, you have to read this part before the semicolon. Then you have to read the other part. So 51,992 is laparoscopy surgical sling operation for stress incontinence, example fascia or synthetic. So the correct answer is D. So you can confuse with the answer B and D. So keep in mind you have to read the additional note below the code. It's very important. So if you encounter this case in a real working scenario, you have to go with the index of the CPT codebook. So when you go to the CPT alphabetic index, there you can directly go to the sling operation. There again you can go to the stress incontinence. Then it will lead you to 51,992. That is the laparoscopic method, and 57,285, that is open method. So you can check the code with the tabular list and finalize the answer. So once you finalize, the answer will be D. Question number 2. A 55-year-old female has a stricture of the left ureter with ileal conduit at the uretero-ileal anastomosis. She has had this chronic stricture and she receives scheduled stent changes on this side. She is here for her regularly scheduled stent change. What CPT and ICD-10 CM codes are reported? There are CPT and ICD-10 codes are available. Please pause the video, take your CPT and ICD-10 codes and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight this is stricture of the left ureter. That is a chronic ureter. Now the patient came for the scheduled stent changes. So she is here for regularly scheduled stent change. Okay, when you see the CPT codes, there are 50,000 codes and 52,000 codes are available. So those codes are adjacent codes. So you can first take the CPT code, use the elimination method, and you can narrow down the answers. Then you can go to the ICD-10 CM codes and find the correct answer. Okay, so let's go to the CPT codes. 50,688, that is change of ureterostomy tube or externally accessible ureteral stent via ileal conduit. So that is the correct scenario here. So if you see the other answers, 50,605, that is ureterostomy for insertion of indwelling stent all time, and 52,332 CystoUrehroscopy, that is not relevant here. So you can narrow down the answer to CPT codes 50,688. So you can omit the other answers that not having the code 50,688. So you can omit B and D. Now let's go to the ICD-10 CM codes. So when you see the ICD-10 CM N99.89, that is other post-procedural complications and disorders of genitourinary system. So that is not relevant here. And Z code Z43.6, that is encounter for attention to other artificial openings of urinary tract. So here this case is the ureterostomy. So encounter for attention to ureterostomy. So that code is suitable. So in this case, 50,688 CPT code and Z43.6 ICD-10 CM code is suitable. So the correct answer is C. So when you encounter this case in a real working scenario, you had to find the answer using the index of the ICD-10 CM and CPT. So once you go to the CPT alphabetic index, here you have to go to the ureterostomy stent changing. So ureterostomy stent, the subcategory change, then it will lead you to the code 50,688. Then you have to go back to the tabular list and confirm the answer. When you go to the ICD-10 CM alphabetic index, here you have to go with the attention to. So attention to the subcategory ureterostomy, it will lead you to the code Z49.6. Then you have to go back to the tabular list and confirm the answer. So correct answer is C. But here, according to the ICD-10 CM guidelines, Z codes are sequenced depending on the circumstance or problem being coded. Some Z codes are sequenced first to describe the reason for the encounter, while others are sequenced second. The aftercare codes are generally first listed to explain the specific reason for the encounter. So here in this case, the patient came for the aftercare, so the Z code should be coded as the first code in the ICD-10 CM coding. Question number 3. A physician performed a CystoUrehroscopy with an ejaculatory duct catheterization and irrigation. Duct radiography was also performed to visualize the ejaculatory duct system. What CPT code should be reported? So there are 52,000 and 74,000 codes are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, here you have to highlight this is the CystoUrehroscopy with an ejaculatory duct catheterization and irrigation. Also duct radiography and visualize the ejaculatory duct system. You may aware this is a test do in a male for infertility. So here you can see the first code are 52,000 and 52,010 and also 74,440 also available. So you can use the elimination method to find the answer. So directly go to the code. So when you go to the code 52,000, it says CystoUrehroscopy, that is separate procedure. 52,010 says CystoUrehroscopy with the ejaculatory duct catheterization with or without irrigation, instillation or duct radiography exclusive of radiologic service. So here this code is perfectly matching the scenario, that is CystoUrehroscopy with an ejaculatory duct catheterization and irrigation. Also when you see the 74,440 code, that is vasography, vesiculography or epidermography, that's a radiological supervision and interpretation. In this case, you have to know that vasography is a radiographic procedure used to evaluate the patency, that is openness of the vas deferens and ejaculatory ducts in males. So here in this question, it says ejaculatory duct system. It's not directly says the vasography, but the ejaculatory duct system visualization is called vasography. So in this case, 74,440 also additional code here. So the correct answer should be C. Okay, when you encounter this case in a real working scenario, you have to go to the CPT alphabetic index. There you have to go to the CystoUrehroscopy. Then go to the subcategory of ejaculatory duct catheterization. It will lead you to the code 52,010. Again, go back to the tabular list and confirm the answer. Similarly, go to the X-ray and go to the duct radiography. There it will lead you to 74,040. Again, come back and confirm the answer with the tabular list. Again, that will give the answer C. Question number 4. A VBAC is performed on a 30-year-old woman who received routine obstetric care for 9 office visits from physician A and postpartum care and delivery from physician B from a different practice. What is the correct CPT coding for physician B service? So there are 59,000 code series are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you have to highlight VBAC. VBAC is vaginal birth after cesarean section. Vaginal birth after cesarean section, that is in short form called VBAC. This VBAC is run after routine obstetric care of 9 office visits from a physician A and postpartum care and delivery from physician B from a different practice. Here you have to be very careful. The question is asking only for the physician B service. You can see what is the correct CPT coding for physician B service. So you no need to code for this previous obstetric visits of 9 office visits, those kind of things. You no need to code here. Here it is only asking for the physician B service. Here you can see the answers are 59 series. So you can directly go for the elimination method and find the answer. So once you go to the answers, 59,610, that is routine obstetric care including antepartum care, vaginal delivery with or without episiotomy, and postpartum care after previous cesarean delivery. 59,612 is vaginal delivery only after previous cesarean delivery with or without episiotomy and forceps. 59,614 is including postpartum care. So in this case, you can see the physician B, what he has done is postpartum care and delivery from the physician B. So in this case, you have to code 59,640, that is including postpartum care. This code is the continuation of the previous code. The previous code is vaginal delivery only after previous cesarean delivery including postpartum care. So the correct code is 59,614. If you see other codes like 49,425 antepartum care only 4 to 6 visits, 426 is 7 to 9 more visits. So this code is suitable for the physician A service, but in this question it is not asking for the physician A service, so no need to code this one. Also, if you see the other code 59,400, that is routine obstetric care including antepartum care, vaginal delivery and postpartum care. So that is not the case here. So here the physician B service is vaginal delivery only after previous cesarean delivery including the postpartum care. So correct answer is B. So if you encounter this case in a real working world, you have to go with the CPT index. So if you go to the CPT alphabetic index, here you have to go for the postpartum care. In this postpartum care, you have to go for the subcategory vaginal delivery, that is 59,430. But in this vaginal delivery, this is after previous cesarean section delivery, so that is 59,614. Again, you have to go back to the tabular list and confirm the answer. So the correct answer is B. Question number 5. A patient with Bartholin's gland cyst present to the clinic for incision and drainage of the cyst. Due to the size and area of the cyst, the physician decides to incise the cyst and suture the lateral sides, leaving one side open for drainage. Which of the following codes would be represent the physician's work? So there are 56,000 and 53,000 codes are available. So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, you had to highlight this is Bartholin's gland cyst. And physician have done incise the cyst and sutured the lateral sides, leaving the one side open for the drainage. So you can see the adjacent codes are available. So you can use the elimination method to find the answer. So directly go to the codes. When you go to the codes, 56,420 is incision and drainage of Bartholin's gland abscess here. But not only incision and drainage, there is also one side suturing. So if you go to the second code, that is 56,440, Marsupialization of Bartholin's gland cyst. So in this case, you have to know what is marsupialization. If you know only, you can correctly answer this question. Because the marsupialization of Bartholin gland cyst is a surgical procedure where an opening is created in the cyst to allow for drainage and prevent future blockage. This is done by creating an incision in the cyst wall and then stitching the edges of the cyst to the surrounding skin, effectively creating a pouch that allows continuous drainage. That is, when you do the IND, incision and drainage of Bartholin cyst, the one side is sutured and other side is kept open. This procedure is called marsupialization. But in this question, the term marsupialization is not mentioned, but you have to know this is the marsupialization case. So the correct code should be 56,440. If you see other codes, 56,740, that's it, excision of Bartholin cyst glandocyst. This is not the excision, this is incision and drainage. So the correct answer is answer C, that is 56,440. This is called marsupialization of Bartholin cyst. So if you go with the CPT index, you can go to the Bartholin cyst gland, then go to the subcategory cyst, then go to the subcategory of marsupialization. That will lead you 56,440. Again, you have to go back to the tabular list and confirm the answer. So the correct answer is C. Question number 6 of 50,000 series codes. A physician performed a biopsy of the thyroid with the use of a percutaneous core needle using fluoroscopic guidance. Aspirate was sent to the laboratory so that the pathology of the disease could be determined. What is the correct code for this procedure? So please pause the video, take your CPT code book and find the answer.
3, 2, 1.
Okay, in this case, we have to highlight this is biopsy of the thyroid and percutaneous core needle using fluoroscopic guidance. And also the aspirate was sent to the laboratory for the pathology test. Okay, when you see the answers, all answers are adjacent. The first code is 60,000 and 60,100 and other codes are available. So you can use the elimination method to find the answer. So directly go to the codes. If you go to the code 60,000, it says incision and drainage of thyroglossal cyst infected. That is not the case here. Here we have done the biopsy. 60,100 is biopsy thyroid percutaneous core needle. So that is the case. Here you can see biopsy of the thyroid percutaneous core needle. But here an additional thing, that is using fluoroscopic guidance. So this code is not mentioning about the fluoroscopic guidance. But the additional note of the code says if imaging guidance is performed, see 76,000 codes and 77,000 codes. When you go to the code 76,942, that is ultrasonic guidance. But in our case, this is the fluoroscopic guidance. So when you go to the other code, that is 77,002, that is fluoroscopic guidance for the needle placement. So it is an additional code. You can see the plus mark. So you have to code the main code, that is 60,100 and 77,002. So the correct answer is C. The pathology codes 88,172 and 88,173 should not be coded by the physician because he or she did not perform the laboratory service. The lab performed the service separately and should code for the item separately. So in this case, you have to code only for the physician procedure here. So if you encounter this case in a real working scenario, you have to go with the CPT alphabetic index. So when you go to the CPT alphabetic index, first you have to go to the biopsy or needle biopsy. Then you have to go to the subcategory of thyroid gland. That will lead you to the 60,100. Again, you have to go back to the tabular list and confirm the answer. Their additional note will guide you to imaging guidance. If the imaging guidance is performed, the additional codes you have to check. Again, when you check the codes, the 77,002 is suitable. So the correct answer is C. So if you are preparing for the AAPC CPC examination, my channel will help you to solve the problems you are facing in your examination preparation. So please subscribe my channel. And if you have any doubts or any questions, you can put in the comment section, or else you can email me, or you can WhatsApp me to the email and the WhatsApp number displayed here. So please subscribe my channel and stay with me. Thank you.